Muskoka District Health Unit, here to provide you with the COVID-19 update for Central Muskoka. As of today, we've had a total of 10,154 cases. This is up by 617 cases from a week ago when I last reported. This is the first time we've surpassed 10,000 cases. I think that is a noteworthy milestone. This is actually a reduction in our weekly case count compared with the week of April 11th when we had 714 cases. So this is the first time we've had a downturn in cases since the week of the 7th of March. Ever since then, it's been a steady climb. Even though it is welcome to see it come down a bit, I do note that testing is slightly down and our percent positivity rate is slightly up. So we need to be cautious in our interpretation of whether or not it's truly come down or not in terms of transmission in our community. We've got 1,327 active cases, which is up from 1,141 active cases a week ago. And we've had a total of 222 people pass away. So this is an additional 4 deaths over the past week. I would like to express my condolences to the family members of those who've passed away for your loss. And those people are as follows: a woman between the ages of 65 and 79 from Muskoka District, a man 80 or more years of age in Simcoe County, a woman between the ages of 65 and 79 from Simcoe County, and a woman 80 or more years of age in Simcoe County. None of these individuals had been immunized. April, we've had the 3rd highest number of deaths of any one month throughout the course of the pandemic. At so far 30 deaths, noting that the month isn't quite finished, followed by February when we had 32 deaths, and January with 88 deaths, which was the most that we've ever had in a single month. And in that month, we had a substantial number of deaths related to very large healthcare facilities and long-term care facilities in Outbreak. 52 of our residents in Simcoe Muskoka are currently hospitalized with COVID-19. This is up from 47 a week ago, and 13 in the intensive care unit, which is unchanged from a week ago. For those hospitalized, their ages range from in their 20s to in their 90s. 45 are from cases in the community and 7 are from outbreaks. So 45, I should say, were sporadic cases not associated with outbreaks, and 7 were associated with outbreaks. The number of cases in the intensive care unit in the month of April remains the highest that it's been since the start of the pandemic. So of the people, the 52 people who are hospitalized right now, 14 of them are under the age of 60. And among those, 4 are in their 40s. 3 of those 4 are in the intensive care unit. 9 of the individuals in the hospital are in their 50s. 2 of those 9 are in the intensive care unit. 17 are in their 60s, with 4 of those 17 in the intensive care unit. And 21 are 70 or more years of age, and 4 of those 21 are in the intensive care unit. In the past 24 hours, we've had 66 cases reported to us. 64 are sporadic cases, One is associated with an outbreak in an educational setting out of jurisdiction, not within Simcoe Muskoka. One is part of an institutional outbreak. 36 are male, 30 are female. About half of them, 50%, are under the age of 40. All are from Simcoe County. 8 are community acquired, which means we don't know how it was acquired. 16 were close contacts of a case. 1 part of an outbreak in an educational setting. 40 are under investigation, and 1 is part of an institutional outbreak. 64 are self-isolating, 1 has recovered, and 1 at this point we don't know, are under investigation. The vast majority of our active cases in Simcoe Muskoka reside in South Simcoe, Bradford, West Gwillimbury, New Tecumseh, Innisfil, and in Barrie. Our weekly incidence of cases is 107 cases per 100,000 population per week, which is down from 120 a week ago. And the provincial rate at this time is 187 cases per 100,000 population per week. The incidence in Bradford, West Gwillimbury over the past week was 319 cases per 100,000 population per week, which is a 6% decrease from the 340 cases per 100,000 population per week a week before. And it's the 3rd consecutive week in which their incidence has been above 300 cases per 100,000 population. Barrie and Innisfil had 150 cases per 100,000 population per week over the last week. And it is young adults and middle-aged adults who have the highest incidence of cases per 100,000 population through the month of April. If you look at our educational settings, there is a reduction in cases associated with educational settings in April versus March, which of course would be in keeping with the closure of schools in the month of April. In the month of April, we've had 17 cases related to elementary or secondary school setting outbreaks versus 40 of such cases in the month of March. In terms of variants of concern, they've essentially almost completely taken over the COVID cases that we have. So in the week of April the 18th, 95% of our COVID cases were actually variants of concern. And so far this week, all of the cases that we've had have been identified as variants of concern. And this is to be compared with about 50% of our COVID cases at the beginning of 2021. The great majority of our variants of concern are the B117 variant, but we have had a number of P1 variants. So at this time, we have 29 of such cases. Recently, 7 cases of the 29 were reported as P1 variants. We've had 3 B1351 variants recently, totaling 5 to date. In terms of our outbreaks, we now have 27 outbreaks, up from 22 a week ago. 19 of these 27 outbreaks are from variants of concern. Two of these are institutional outbreaks, which is unchanged from a week ago. We have 1 new one, Muskoka Shores Long-Term Care Facility in Gravenhurst, and 1 declared over, the Waterford Retirement Home in Barrie. We have 5 congregate setting outbreaks, up from 4 a week ago, so 2 new ones, both group homes in Simcoe County, and 1 declared over, a group home in Simcoe County. With 13 workplaces, up from 11 a week ago, 2 new ones. Manufacturing facility in Simcoe County and a transport facility in Simcoe County. We have two community setting outbreaks, which are new, one at a real estate rental and leasing location in Simcoe County, and one in a religious organization in Simcoe County. And we have 5 educational settings, which is unchanged from a week ago. So one new setting, a childcare center in Simcoe County, and one declared over, a post-secondary institution in Simcoe County, a private facility. In terms of our vaccination, as of yesterday, the health unit and partners have administered 171,750 vaccinations, including over 9,500 AstraZeneca vaccine doses administered by primary care teams, and 19,750 doses administered by local pharmacies. So about 28% of Simcoe Muskoka residents have received their first dose of vaccine, and about 3% have received their second dose of vaccine. One thing of importance to note, there was a report put out by the Ontario Science Table on COVID last Friday, April the 20th, which identified that the proportion of the population of Ontario that would be required to be vaccinated to achieve herd immunity would be anywhere between 56% to 89%. So reaching 89% of the population will be a great challenge for us to achieve, although we are making good headway. We have up on our website information about vaccination coverage by age group. So certainly I invite members of the public and the media to have a look at that. We have very high coverage rates for older age groups, for 80 and 75 to 79, both above 80% for first dose. And for those 70 to 74, 76.8%. Other age groups are much lower levels, but I have full confidence that they will rise as we work through priority groups, which are in part based on age. If you look at our website, you'll find under immunization section that we have data about the level of immunization coverage by municipality, lower tier municipalities, as well as upper tier. So we have a total of 26 municipalities in Simcoe Muskoka. And it's also broken down for each of those by age groupings as well. So we have noted that there are some municipalities that have a reduced level of coverage. And in particular, we were looking at those that are 80 plus. And we've reached out to those that have a coverage of 70 or less % in order to work with the municipalities to enhance coverage, to work with them to provide additional supports or identify with them ways in which we could enhance coverage. And I'll be speaking in a little bit more detail on that later in my presentation. One of the things I would point out is that you'll also see the coverage for the populations as a whole. And I think it is more meaningful to look at the breakdown by age category by municipality, not just what the coverage is for the whole, because municipalities with younger populations will tend to have lower coverage at this point, since we've focused on providing immunizations to older age groups. Those municipalities with younger populations will experience a catch up in coverage over time as we move into younger populations. If we look at our dashboard, the framework that we developed for ourselves, not the province's framework, we remain in red status, including for virus spread and containment. One of the things we note is that our community cases has elevated now to 30.9%, which is the first time that we've had it that high since we've created the framework, the dashboard. These are cases in which we don't know how transmission happened. And I think it speaks to the potential for transmission to be happening out in the community, and that people need to take to heart the stay-at-home order, staying home and only going out for essential reasons. And when you do go out, to exercise the precautions of distancing 2 meters from others, wearing a mask, and self-isolating, seeking assessment and testing if you develop symptoms, and hand hygiene. So all of that's really critical if we're seeing high rates of transmission in our community and now a higher rate of community cases. That speaks to the risk that exists in the community at this time. Laboratory testing remains at yellow. It's actually an improvement. It had been red. We have had some, unfortunately, an increase in percent positivity, so that's not going in the right direction. But our turnaround time for for testing has improved, so that on that category, we're back in green. Health system capacity is in red now, up from yellow. This is because we have had some increase on the ICU bed admissions. Right now, we're at an 83.6% occupancy, and our ventilation, people on ventilation, those beds are at 77.8%. So for those reasons, we've got a greater burden on our healthcare system related to both our own cases, but also cases that have been transferred here from GTA hospitals. And the public health system capacity remains in red, related to our compromised turnaround time for reaching contacts. Although that has improved slightly, we're reaching 77.9% of our contacts, of our cases within 24 hours, which is up from 75.7%. Our goal is better than 90%. I had indicated that testing overall volumes in Simcoe County in particular are slightly down, slightly up in Muskoka. And also indicated that our percent positivity had gone up at 6.1 this week. Last week it was 5.4. And now higher in Simcoe County, but lower in Muskoka. So Muskoka down to 3.2. Last week it had been 6.1. Simcoe County, 6.4%. It had been 5.4 the week before. And the province at 8.1, so we're below the provincial rate on this. We note that it is, once again, youth that have the highest percent positivity, noting that, and here we're talking about those between the ages of 10 and 19. And then I also note that it is young adults that have had the highest incidence of cases in Simcoe, Muskoka. We also note that Bradford, West Gwillimbury has a high percent positivity, greater than 10%, and Lake of Bays is about 20%. Although with small populations, you can get fairly wide swings with small numbers in Lake of Bays. It's also been noted that about half of the COVID cases in local hospitals are from elsewhere, not from Simcoe, Muskoka. We do have most of the time a number of our cases elsewhere, not in our district. People from Simcoe, Muskoka's cases being cared for out of district. In terms of some key messages, we continue with phase 2 of the vaccine campaign, and the province have just announced that pregnant individuals are now eligible to receive immunization as having very, very high risk health conditions. So this is something that's been appreciated in the third wave, that pregnant individuals have been found to be much higher risk of severe disease and complications. And in order to be booked to be vaccinated here or elsewhere in the province is requiring that people would use their provincial vaccine booking line at 1-833-943-3900. It's information up on our website. And that a letter is not required for them from their healthcare provider in order to receive immunization. It's recommended but not required that pregnant individuals discuss the risks versus the benefits of vaccination with their healthcare provider who's familiar with their pregnancy. But certainly they would receive immunization if they've not had that consultation. Also, it should be noted that for individuals who are in a very high risk health condition category, there is the potential for an essential caregiver, one essential caregiver for them to receive immunization. But they define essential caregiver as somebody that's providing personal care and or assistance with daily living, and therefore not just a partner of these individuals. And so in most instances, this would not apply to pregnant individuals coming for immunization. Bradford, West Gwillimbury remains our provincially designated hotspot, and we are working closely with that community, the municipal council and other partners to provide immunization. And since April the 23rd, I've been providing immunization for those who are 40 and older, that those individuals can book through the town website. And as of today, by direction from the province, those individuals who are in that community who are 45 and older can book via the provincial online booking system. We do see an improvement in coverage for vaccination in this community. So prior to April 15th, 12% of the residents of Bradford, West Gwillimbury had their first immunization. As of April the 25th, we're up to 23% of the residents having received their first immunization. That's still below the rate for Simcoe Muskoka overall, but the rate of increase or improvement is higher than the rate of increase that we've had for Simcoe Muskoka. So the intention is with this as a hot spot with very high incidence of disease, and so far very low, a reduced coverage rate, that we give priority to providing immunization in that community. So we have special clinics and additional appointments that will continue to be added for this priority group based on our vaccine supply as communicated to us from the province. We also, at this time, have been providing immunization to agricultural workers, in particular temporary foreign workers, but also other agricultural workers, and have provided last week in Bradford, West Gwillimbury, immunization to over 90% of the workers of the Holland Marsh area. This was organized by the Holland Marsh Growers Association in collaboration with the Health Unit and York Region Public Health and the local municipalities. So certainly I want to commend all involved, and it's certainly an important success given the vulnerability of this group that we experienced last year with outbreaks. Ontario has expanded the vaccine eligibility to licensed childcare workers. So this is to begin as of April 29th. Childcare workers in licensed childcare settings will be eligible to book an appointment through the provincial vaccine booking line number at 1-833-943-3900. And this information, once again, is up on our website. So eligible childcare providers in licensed childcare settings will receive a letter from their employer. And the letter must be made available at the time of the receipt of their immunization, and also recommended to be available to you for your booking. In the coming weeks, it's expected that eligibility will be expanded to childcare workers in unlicensed childcare settings across the province. Also, we would like to inform people that individuals coming to our immunization clinic who need special support of some kind, that we're happy to provide this. We want to do all that we can to ensure that everyone who attends our clinics has a positive experience. We're able to provide accommodation in a number of ways to support our clients' needs, such as providing a low stimulation environment, drive-through option, or an appointment before or after the clinic starts. So for those who would benefit from these supports, please call our COVID-19 immunization appointment booking support line at 705-721-7520 or a 1-800 number, 1-877-721-7520, extension 5997. And our staff would be happy to make this arrangement for you, and this information is on our website. I'd mentioned we do have information now, data on our lower tier and upper tier municipalities in terms of immunization coverage by age group, and overall, we have found that there are 7 lower tier municipalities that have vaccination rates of 70% or less among adults 83 years of age or older. And we've reached out to those municipalities and are working together to develop and implement tailored strategies for each increase vaccination coverage in these communities. Some strategies we're exploring include pop-up vaccination clinics, advocating for additional pharmacies to be included to provide immunization in those communities. So that's us advocating to the province to authorize that, and expanding the availability of transportation supports or awareness raising and promotion to the members of these communities. Just a reminder that the best vaccine for anyone is the first one that is available to you, and that you should take every opportunity to take the first vaccine available to you. With rapid transmission of COVID-19 in our communities at this time, it's important that you not delay in getting vaccine when you're eligible. Next week is Mental Health Week, and communities, schools, and workplaces will be rallying to celebrate, protect, and promote mental health. We know that the pandemic has taken a significant toll on people's health nationally and locally. We have our own data demonstrating that 45% of Simcoe Muskoka residents report on our survey increased stress levels, and 49% reported worsening anxiety since the start of the pandemic. So clearly it's having a local impact. We encourage you to attend an event called Our Health North Simcoe's, a live event on mental health and addictions in the time of COVID-19, which is taking place next Thursday, May the 6th at 7:30 p.m. A local panel of experts will unpack the impact of the pandemic on mental health and explore options for local support. This event will be broadcasted on all Rogers TV Simcoe County channels, and also one can visit a website for more information and tools about Mental Health Week at www.mentalhealthweek.ca. We are preparing for an education and enforcement initiative being led by the Ministry of Labor, Training and Skills Development, which will take place in partnership with Simcoe Muskoka District Health Unit and local bylaw enforcement officers to ensure workplaces and businesses are following public health guidelines and requirements and properly protecting workers and the public from COVID-19. So from Friday, April the 30th through to Saturday, May the 1st, the province will be working with local police, public health, municipal bylaw enforcement officers to conduct education and enforcement visits across Simcoe, Muskoka to businesses and workplaces. And these inspections will assist with confirming that retail businesses and workplaces are complying with the Provincial Reopening Ontario Act and its regulations. Some of the measures in these regulations of note include having safety plans written and posted where easily seen, screening staff and customers for symptoms of COVID-19, proper use of masks and face coverings, and control measures for crowding to limit capacity, ensure 2 meters of physical distancing. So businesses are encouraged to visit our website, the Simcoe Muskoka District Health Unit's website, where information and resources are housed to support them in operating in compliance with COVID-19 emergency measures. And of course, we're available by our Health Connection line. So we have the following questions from the media. Why are vaccines being taken away from some areas and moved to hotspots? And what I would say is that we know from research that there are areas of this province that have much higher incidences of COVID-19, much higher hospitalization rates, higher ICU admission rates, and higher mortality. We know that in Simcoe, Muskoka, there are areas that reflect that, and certainly the hotspot that the province has identified in Bradford, West Gwillimbury, reflects that. Our highest incidence and burden of illness has been in that municipality. And some research from the COVID-19 science table of the province released last week demonstrated that by providing much more in the way of immunization in these hotspot communities, we can have a substantial reduction in the overall incidence, hospitalization, and mortality for the province as a whole. And that if there's a focus in these communities on essential workers as a population, that would be part of the solution, noting that there is transmission from young workers to the rest of the population, including to older individuals who are at risk. And so a way of reducing risk overall is to provide more vaccination in those areas to those groups. And certainly it's important that we continue to provide immunization to everybody over time. But the province at this point is directing us to give more focus to those hotspot communities. And this is actually in keeping with the province's plan for phase 2 immunizations, that there be a focus on hotspot communities. So it is part of the province's intention to begin with. What is the health unit doing to get more vaccine supply in our area? So one thing I would say is that we've received communication from the province that we can expect quite a substantial increase in the volume of vaccine through the month of May. In the early part of May, very much directed towards our hotspot community, but for the latter part of May, an even larger portion coming to us simply on a per capita basis. And this is Pfizer vaccine, and it's really related to an increase in supply of Pfizer vaccine to the country. So certainly that will be of great benefit to us, but we have advocated in the past for additional vaccine based on our hotspot community and received it within the last 2 weeks. And then in February, received additional vaccine based on our response to the variants of concern, and in particular, the outbreaks that were happening in the healthcare facilities and long-term care facilities from variants of concern. And we'll continue to monitor the balance of vaccines that are provided here. So we do note that people can come here from out of area to receive their immunization. We also know that some of our citizens here have gone out of district to receive their immunization. I note that with our large seasonal population that we need to keep a tally of the balance of that. How much vaccine are we providing to people from out of district versus how much vaccine is provided to our citizens who go out of district to get it? And if there's a balance that we're giving more than we're getting, essentially, that I would use that as a means of advocating to the province for additional vaccines. So certainly we're going to keep an eye on that, and that would be another approach to be taken. Will we be getting the Johnson & Johnson vaccine in Simcoe, Muskoka, and if so, when? So my understanding is that vaccine is coming to the country soon, possibly the first week of May, that the province is awaiting a determination of how much vaccine would be coming before they'd be able to determine how much each health unit would get. That we also need guidance from the National Advisory Committee on Immunization as to the best use of that vaccine. So at this point, we await more information. COVID-19 illness continues to impact essential workers. When will they be prioritized for vaccination? So certainly in Bradford, West Gwillimbury at this time, we are prioritizing that as a hotspot community and immunizing those that are 40 years of age and above. We know that in Peel and Toronto, there has been some focus on immunization through large employers to essential workers. And we are at this time working with the municipality, Bradford, West Gwillimbury, in order to identify large employers who would be in a position to be able to receive and provide vaccine to their essential workers. So we're getting ready for that stage, and we're also getting ready to be able to move to a younger age group to include for immunization. We have to do this in a staged fashion based on the supply of vaccine that we get. So we make our preparations and we look forward to being able to make those additional moves. With regards to essential workers elsewhere in Simcoe, Muskoka, we are following the provincial phase 2 direction, which is that they will indeed be recipients of immunization later in phase 2. At this point in time, we're still concentrating on those that are 60 plus years of age, and those that live in congregate settings, those that have very high or high risk health conditions. And we otherwise are preparing to be able to move to essential workers when supply allows and when we get direction from the province to do so. So I would say at this time, it's critically important for all to continue with the precautionary measures, the public health measures, for those that are immunized and those who are not, everybody to continue with those protective measures, abiding by the stay-at-home order, going out only for essential reasons. Of course, for essential workers, that means leaving their home to go to work. Those that cannot work remotely, those who can work remotely should do so. And then the work environment needs to be carefully managed to allow for physical distancing and mask use and other precautions, as I've cited earlier today. When do we stop educating and start fining those breaking the stay-at-home order and gathering restrictions to attend anti-lockdown rallies? So we work with our partners in enforcement, which on much of this is the police, and police have been responding to and seeking to control and reduce the harm associated with rallies. In particular, a series of rallies have been taking place. I would emphasize that individuals who participate in these rallies are taking a risk to their health and to the broader health of the community by not abiding by the stay-at-home order, by being in close proximity to each other, and by not using masks, and that they can become cases via this means, or bring it home to their families, or continue to transmit it in the community. So I would strongly advise that they not participate in these rallies and find other means of expressing their views of opposition, including through distance, remote means. We do have recommendations on our website about public gathering protests and means of reduction of harm associated with them. But we are aware that Barrie Police, with regards to the rallies in Barrie, have issued tickets at these protests and will continue to do so. And my understanding is that they've arrested one individual as well for obstructing the police. The health unit's current data on hospitalization, only reports on hospitalization of Simcoe Muskoka residents, can this be adjusted to include all individuals who are being treated for COVID-19 in our local hospitals. And I completely agree that there is value in us not only reporting on the degree of illness of our residents, and being hospitalized is an indicator of severity of illness. And when we do report on hospitalization for our residents, that they can be hospitalized anywhere, not just in Simcoe Muskoka. That data is about the fact that they're hospitalized, not where they're hospitalized. But I agree that it's also important for us to talk about and demonstrate the impact on our healthcare system here. Our dashboard has indicators that speak to that, but they are expressed in terms of percentages of ICU occupancy or hospital bed occupancy. What we will do is develop and put up more information about specific numbers of individuals in our healthcare system locally. With the additional resources being sent to Ontario from other provinces and the military, will you be asking for additional support for the health unit's efforts, such as contact tracing or for local hospitals? How much can additional human resources help with our local COVID-19 response? So with regards to the health unit, we're already actually making very good use of a provincial workforce made available for case and contact management. So about 40% now of our cases are being managed in this way, and that's been indispensable to us. We've also recently hired additional staff to help with our team, and are seeking to hire even more additional staff to help with our case and contact management, with our outbreak response, and with vaccination. Given the increase in vaccination that's coming, we're looking at how many more we're going to need to hire for immunization. But at this point in time, we haven't contemplated, I've not contemplated making a request to the military per se for assistance. Noting, we're making a good use of the supports from the province. With regards to the rest of the healthcare system, such as hospitals, they would be in a much better position to be able to determine what their needs are and how they would best meet their needs, including the potential to request such assistance. So at this point, I'd be happy to address any questions.
Thanks so much, Dr. Gardner. We will now take some questions from the media. Just a friendly reminder to please limit yourself to one question and one follow-up to make sure that everyone has the opportunity to participate this afternoon. And also remember to please mute and unmute yourself. Can we start with Chris Simon from the Barrie Advance? Do you have a question today for Dr. Gardner?
I certainly do. Hi, Dr. Gardner. The blitz that you said is going to be taking place this weekend. Last time something like this was done, it was kind of billed as a big box store blitz. Are there any particular businesses being targeted this time? As I'm sure you're aware, manufacturing facilities have a significant amount of outbreaks over the course of the pandemic and still seem problematic.
I think that's a really good point. And I actually don't have a good sense of that. So what I will do is speak with my staff, get a better sense as to whether there's a change in focus, and put that out to yourselves.
Okay. And my other question is about the variant that has come out of India. I know last week it was confirmed by the Ontario government that several cases had been found. Is there any indication that the variant has spread to our region?
What I would say is that I did receive preliminary communication on the weekend from Public Health Ontario indicating that we actually do have a case. I was asking for more specifics, which I've not yet received.
Thank you.
You're welcome.
Thanks, Chris. Do we have a question for Dr. Gardner, Erica Engel today from Collingwood Today?
Hi, yes, thank you. My question is if the current caseload and hospitalization and even death rate continues, how does that impact like things like immunization schedules, and what are the repercussions of cases not going down right now?
So this is certainly a bigger wave than the previous two waves in terms of cases, hospitalizations, ICU admissions. In one sense, at least mortality to date is actually less than wave two to date, I would say, and that may be because of the immunizations that we've managed to achieve, the protection that we've managed to provide to the older population, in particular long-term care facilities. But having a wave at this point in time to this degree means it's going to take a long time to recover. It could take many weeks before we've managed to bring it down to a level that would be safe to open up the restrictions that are in place right now. I think it would be very dangerous to prematurely open, although I'm sure the desire to open is certainly there, but I think we'd end up very readily back into the situation again, and that could very well extend into or through the summer if we were to do that. So we've got to hold the line and take the time it takes to do this effectively to be able to end it before we get into the summer. To me, that's the great implication of it all, the great challenge of it all. And we are fully committed to continuing immunization through it all. We won't compromise that. We have to do all that we can to use up all the vaccine that we get and to provide it to those who need it most first, and to continue to use data like we have to identify areas, municipalities that might be lagging a bit, help them keep up with the immunization. It is ultimately the way for us to bring the pandemic under control in a sustained way. We have to commit to that.
Thank you. And when you say you have to wait until it's safe, not open prematurely, what levels would indicate to you that it might be safe to start opening up? Like, are you looking for an immunization, certain percentage of immunized population? Is it case counts?
So I am aware there's discussions on this very topic at the province. And we would really, I've had some involvement with them, but we would really have to wait and see at that level what they would release, what they would come up with. But I feel confident that it would be based on the incidence of cases. It would be based on how heavily impacted hospitals are, their ICUs, noting that can take a very long time to recover. and vaccination rates. So all of those would be important indicators. And I would really encourage that we make sure that levels are actually quite low before we start opening up, and that it be done in a broad way across the province would be my advice.
Thank you.
You're welcome.
Dana Goldfinger from Global News, do you have a question today?
Nothing for me today, thank you.
Thanks. Mary Beth Hartle from Muskoka Region, do you have a question today?
I do. I was just wondering if Dr. Gardner could elaborate a little bit on the Muskoka Shores outbreak. I'm just interested to know whether these folks have been vaccinated, and if you know what the percentage of vaccination of those folks in that facility have been vaccinated, and whether the health unit is working with them.
Well, let me have a look through my notes. Do know that overall immunization rate is very high for long-term care facilities and retirement homes, above 95%. What I will do is I will get that information for you and get back to you on it, okay?
Okay, thank you, Dr. Gardner.
Mary Beth, do you have a follow-up?
No, that's perfect. Thank you.
Great, thanks. James Bowler from Cogeco, do you have a question today?
I do. Thank you. Dr. Gardner, I just wanted to ask you about the testing rates you mentioned, and we've seen it with the provincial numbers as well. It was quite low today. Can you just sort of explain again why the rates are so low compared to other days?
I never really know why they go up and down, to tell you the truth. I know that they do go up and down. And if you have a look at our website under the testing bar, you'll see that in Muskoka, for the week of the 18th of April, they went up to 156.5 vaccinations per 10,000 population per week. And that was up from 126.3 the week before. In Simcoe, they actually went down. So they were higher than Muskoka, but had gone down from what they'd been. So 215.7 versus the week before at 263.3. So I don't know why, but we do track it. We do know how much.
This obviously speaks to the importance of, looking more at the infection rate rather than the numbers of infected per day, right? And so again, and you were saying that our rates were a bit higher in Muskoka. Where are we at right now in terms of that, and in comparison with Simcoe as well?
So in Muskoka, the incidence of cases per 100,000 population per week is 30 versus Simcoe at 116. So that's your incidence. Percent positivity, 3.2 for Muskoka, which is down from 6.3 the week before, versus Simcoe, presently 6.7%, up from 5.4%.
Thank you.
Welcome.
Mike Arcelides from CTV Barrie, do you have a question for Dr. Gardner?
Always. Good afternoon, doctor.
Oh.
What is troubling you right now with regard to where we are? Is it the unknown? Because it seems that we're making progress. Are we making progress right now?
I believe we are. We've had 3 province-wide lockdowns or shutdowns during the pandemic. The 2 previous ones were effective in bringing down disease rates. We are seeing at least a slowdown, if not a peak. We can't really say at this time that it's a peak, because you really need to wait some time afterward to look back and know for sure that you peaked and had come down. But it looks like at a minimum a slowdown in the rate of increase in transmission provincially and locally. So progress is being made, but we need the rates are very high provincially, and I would caution that it's going to be really weeks before we've got this under proper control.
So what do you say to folks who are saying, look, it's getting warmer out. We're going to see if we see a similar pattern to what we saw last year. We're going to see probably a 30, 40, 50% decrease in rates over the summer months. And then are we going to see this again potentially in September, October, November?
Well, last summer, we actually had a profound reduction in case counts. So the province was below 100 cases below 100 cases per day at that point, as opposed to 3,000-4,000 cases that we've experienced at this time, right? So it's far more of a reduction back then than merely 30 or 40%. It was a profound reduction into.
I'm talking about locally. Yeah, locally.
And locally, we were down to as low as 3 cases a week in the summer. So a profound reduction is what happened last summer. Certainly, I would very much welcome us being able to get to that, but we have a long way to go from here to that level of control. This time we've got vaccination on our side, but we're also dealing with the variants, and we have a much higher rate of transmission now than we had at this time last year.
What are people not getting? Why are we seeing? Is this a variant simply driving this?
Certainly, the variants are a major contributor to what we're dealing with now. Makes the control of it more challenging, much more challenging. The potential for a loss of control much higher. But I had positioned in February that it would have been much preferable if we continued in our shutdown at that time longer to get a better level of control rather than coming out at 1,000 cases per day.
Thank you.
You're welcome.
Mark Claremont from Muskoka Today. Do you have a question for Dr. Gardner?
Yes, thank you very much. Dr. Gardner, if a person goes into the hospital with serious complications from COVID, do they get the vaccine if they have not already had the vaccine before they went into hospital?
People who are acutely ill with COVID-19 don't get the vaccine at that time, but once they've recovered, they would be eligible to receive the vaccine in accordance with priority groups that we're presently vaccinating. So if it was actually a young person who didn't have another indication for receiving immunization, they would be eligible later when they would be included, but they wouldn't be eligible now. If they were a person who fell into a priority group, they'd be eligible once they've recovered.
Okay, that's fine. And also, just to tie two of them here, how long are people normally, is there a normal to be in hospital with COVID? And also, the Prime Minister said that they're stockpiling or buying vaccines for the year 2024. Does that mean that there's going to be a vaccine, a boost? You have to have a booster every year for the vaccine, or for the COVID, rather?
Probably be better if I actually looked at our data about our local cases to see if we can get some information about the average duration of an individual in hospital. But certainly a person who's in the intensive care unit can be in the hospital for many weeks. Okay. And as for what will come for future immunizations, I think we have to wait and see what develops. I think it's wise for government to plan for years, be thinking in terms of years. This virus will, I'm sure, become what we call endemic, which means like seasonal influenza, they're ever coming back, needing to be managed each year. It's quite possible that we will need booster immunizations in the future, that we would need vaccines that are modified to address the variants that predominate. But while it's wise to plan for that kind of future, it's really impossible to say at this point exactly what the details would be about it.
Fine, thanks.
Is there anyone on the line that I've missed who hasn't yet asked their question this afternoon?
Hi there. It's Ian from Barrie 360.
Hi, Ian.
Hi. Chris already asked about the enforcement, which I was curious about as well. But if I could, Dr. Gardner, I'm just wondering, you did mention one person, clarification, who either passed away or was in hospital that had been vaccinated. If you're able to elaborate on that some.
So of all the individuals who passed away, none of them had been fully immunized. One individual had been immunized, but it was actually shortly after the onset of their symptoms. And so the vaccine would not have had sufficient duration of time to be effective.
Okay, thank you. And if you could, you mentioned the numbers of patients in Simcoe County hospitals and ICUs. Again, just clarification, are these all Simcoe County residents, or are these some people who have also been brought up from the GTA because of capacity issues there or elsewhere?
So the individuals that I cited are all citizens of Simcoe Muskoka, and they could be hospitalized both within Simcoe Muskoka and elsewhere. So that was a look at the health of our citizens rather than the burden on our local healthcare system. And I've pledged to have that particular view provided as a regular report as well in the future.
Okay, thanks very much, Doctor.
You're welcome.
Is there anyone else on the line I've missed who hasn't yet asked their question? Okay. Well, thank you so much, Dr. Gardner, for your update today. I'd like to thank everyone else for joining us. Please be advised that there will not be a media briefing next week, but we will resume the week of May 11th. Thank you so much, everyone.
Bye, everybody.
Thank you.